702.
Health and wellness.
It's 23 minutes now before 12 o'clock. Time for our health and wellness feature. And this morning we're unpacking andropause, right? For years, conversations about hormonal changes have largely centered on women. Menopause, mood shifts, hot flashes, and the many ways that women's bodies evolve over time. But men also experience a hormonal shift of their own, one that can quietly affect their mood, can affect their energy levels, relationships, confidence, and even their sense of identity. So this morning, what we want to do is turn the spotlight on this conversation that many men experience, but few actually openly talk about. So andropause, is it something that you have experienced? Other people call it male monopause. How does it show up in your daily life, right? In your emotions at work, in your relationships? And just as importantly, how can you as a man and you as a partner to that man recognize the signs and respond with understanding rather than frustration, and manage this stage of life in a healthy, supportive way? Joining us on the line to guide us through this conversation is Dr. Olwethu Sotondoshe, who is a homeopathic doctor, natural hormone expert, and founder of AskDrOlz. Dr. Sotondoshe, thank you so much for making time for us. Good morning.
Good morning, Clement. Thank you so much for having me. And good morning to your viewers, to the listeners as well.
So let's talk about andropause just from a basic understanding. How do you explain it? What exactly is it? And is it sort of the male equivalent of menopause in women?
Yes, Clement. So, today let's talk about something that men feel but rarely talk about, which is andropause, which is plainly it's male menopause. So what happens? So it's age-related decline in testosterone, not as abruptly as menopause. So in men, it happens over decades, maybe 20 to 30 years for the symptoms to show up, unlike in menopause, which happens abruptly, like when you stop your period, for 12 months, at later ages, 50, 45, and then you'd say you have menopause. But then with men, it happens insidiously, over time.
Okay. And at what age then do the men usually start experiencing this?
Basically, from the ages of 30, so naturally, the testosterone, specifically, and other male hormones, would start declining by 1%. From the ages of 40 to 49, they decline, clinically speaking, by 2 to 5%. And then as the men age, so from the ages of 50 to 59, so the testosterone level would decrease by 6 to 30%, and then from the ages of 60 to 69, they decrease roughly around about 20 to 45%, and then from the ages of 70 and above, they can decrease as high as 70% by 70%.
And is it something that affects all men? Do we all experience it, or does it affect some men more than the others?
Between the ages of 30 to 40, so it doesn't really affect all men. However, these are the symptoms that can point towards it. For example, physical symptoms would include reduced sex drive, libido, low libido, or erectile dysfunction, loss of muscle mass, and the body fat will increase, especially in your abdomen, in the abdomen, and low energy levels, fatigue. And we also, men also experience hot flashes, irritability, mood changes, poor concentration, poor memory, depression, all those like cognitive symptoms as well that females or women experience during that time because of the changes in their hormones. So men as well also experience like those symptoms because we share the same symptoms, but then the difference is like females, like for example, would have like the same male hormones like testosterone, but then only in small quantities. And then also men as well do have like female hormones like progesterone, but then in small quantities. So as men age, those hormones also decline, so would experience the same symptoms.
Mm-hmm. This is quite fascinating. A lot. Do people talk about this, Dr. Sotondoshe? Men in particular, from your experience, is this known that these are the kind of things you will go through when you start entering this specific age, and these are the hormonal changes? Because I think a lot of men out there have experienced these symptoms, but I don't think a lot of them actually attribute them to andropause.
Yeah, not really, like not openly, like because like men barely talk about like just like men barely visit like clinics or like hospital as compared to females. So men tend to be more closed up, and even if like something is amiss, so and then sometimes they don't even have a clue, or they don't really want to talk about, like, for example, like the decreased libido levels, like the decreased libido, so they don't really want to talk about it. Maybe they're shy, like, to talk about it, or, they barely mention this. So you would point this out, or you would pick this up maybe during the consultation, and then when you look into symptoms, like symptom assessment and blood test as well, and then you'd notice that, maybe total testosterone like is low, and then you then try to investigate what is going on, obvious, like in relation to their age as well.
Yeah. And I often wonder then what the psychological or emotional effects are, because beyond the physical changes, there are psychological or emotional effects that men may also experience during andropause. So do we also go through mood swings, irritability, anxiety, depression, some of these symptoms that sometimes get mentioned by some women who experience menopause?
Yes, of course. Like mostly depression, it's usually misdiagnosed as just like classical or clinical depression. But then from a root cause perspective, like when you look into it, you'd find that it's because like a man is going through like andropause. As I mentioned, that one of like some of cognitive and emotional symptoms that men would experience include like depressed mood, irritability, loss of motivation, and sleep disturbances as well. It's quite common. Like I said that a lot in my practice. Yeah, sleep disturbances as well. But then that is very interesting because when they experience the sleep disturbances, so usually like a person goes through the circadian clock where like certain hormones are most optimized at certain hours of the day. Like for example, when you want to test the testosterone level, you test them around 7 to 10 because they are usually at their optimal level. So now if you do not sleep well due to andropause, that means like your testosterone will further decrease because you need like a good restorative sleep. But then now if you don't get that, because that's the time where you sleep, like where in your sleep your body restores itself, like repairs itself as well, optimize hormones as well. So now if you don't sleep because of the andropause, and then that would further like exacerbate the symptoms, the entire symptoms of andropause.
Okay. 011-883-0702. Are you a man that has experienced andropause before? Did you even know about it? Have you experienced mood swings, irritability, maybe some anxiety? And have you been able to sort of link it to andropause? Give us a call on 011-883-0702. You can share your thoughts on the WhatsApp line as well on 072-702-1702. It's 12 minutes before 12.
702. Health and wellness.
10 minutes before 12 o'clock, we're talking about andropause on our health and wellness feature this morning. And I want to know from some of you men who have experienced some symptoms that you are linking to andropause. And I suppose, Dr. Sotondoshe, what a lot of people are asking now is, how do I know that it's andropause? So how can someone tell that difference between just normal aging and the symptoms of andropause? Or is that the same thing?
The diagnosis is through clinical evaluation. So basically, it's symptom assessment and physical examination and blood tests. And then, like, for example, like your blood test, like your total testosterone, it should be between 300 to 1,000, like normally, nanogram per deciliter, like when you test it. However, so if you have those symptoms plus the abnormal labs, and then like you then suspect that, okay, of course, factoring in age as well.
Yes. And what misunderstanding? I mean, there's a question here about homemade and traditional remedies, because there's often misunderstandings about, you know, what can then the men use at home as just home or traditional remedies. And when we talk about these conversations, some men will talk about mpesu, for instance, and others that help manage andropause or maybe deal with their low libido. Are those the things that you recommend for someone who feels, okay, maybe my low libido is as a result of andropause? And what's your advice to someone who then experiences even low libido? Do you just quickly, because of your age, decide, okay, it could be andropause, or just better check with your doctor first?
Like anyone, like before they take anything, either like naturally or even supplement, they should check with their doctor first, because remember, Clement, even those issues and stuff, they are not clinically tested. So it's like we don't really know, even though like from the feedback from the users, they would say no, Mbesu works, but then like you don't know like the clinical complications or whether it's safe clinically or not, because it has not been tested, and the dosage as well. So what is I usually do? So I would test, like obviously, like I would order the blood test and like everything, and the symptoms as well. I would assess them, and then according to so I would manage the low libido andropause based off their individual symptoms or presenting like case presented. So for example, like usually like it can be managed because there are factors that increase the risk of andropause besides like aging and stuff. For example, if you're smoking, you use alcohol, you have diabetes type 2, you're obese, you use anabolic steroid. So those would increase the risk of having or of being like in andropause. So you'd first deal with the low-hanging fruit, which are like stopping smoking cessation, stopping alcohol, and managing type 2 diabetes and reducing weight, before like any supplement or like medication.
Okay. Another question on the WhatsApp line says, Clement, are men boobs also due to this so-called male menopause?
No, like they are not from that. Like usually they are due to estrogen dominance. Estrogen usually it's a female hormone, so it's more dominant, like in female, because for female sexual characteristics and stuff. So it's not supposed to be high in men. So when the levels of estrogens are high, so you develop boobs, because those are like female characteristics as well, sexual characteristics, like boobs and other characteristics.
Here's a WhatsApp that's come through.
Well, Clement, well done. This is the most interesting thing I have learned this week. Thank you for having this topic. And the doctor there is actually doing such a great job explaining it. Thank you so much.
Oh, thank you for that. I know some people are also texting and saying, actually, we didn't know about andropause. Let's talk treatment now, Dr. Sotondoshe. Is there anything that men can take, any treatment, medication that can take care of it, or is it something that they would have to learn to live with?
So, Clement, like, as I mentioned that lifestyle changes, the number one, like first line, like treatment, and then as well as behavioral therapy treatment, like going to a psychologist or psychiatrist for depressed moods and irritability, and controlling your diet as well. And medical doctors do prescribe hormone replacement therapy. However, it's not really clear the benefits. It benefits some, but then it also has very bad side effects. For example, complications. For example, it can increase the risk of getting heart attack, stroke, clotting. So it's always good to do lifestyle changes first.
Yeah.
But then if your symptoms do not improve, and then your doctor can weigh the benefits and the cons of taking HRT.
Yeah. Oh, Dr. Olwethu. Yeah.
Okay, just to add one thing more before. Yeah. So as well as because when you inject testosterone, that means it's an exogenous testosterone. It's not an endogenous. That means your body doesn't recognize it as So it won't have the same effect or impact as your own natural testosterone.
Okay, got it. Dr. Olwethu Sotondoshe, thank you so much for such an insightful chat. I really appreciate your time.